Most people think the gut is just about digestion. Food goes in, nutrients are absorbed, waste leaves the body, and that's it. But as a doctor, I can tell you this is one of the biggest misunderstandings in modern health. Your gut does far more than digest food. It influences your immune system, your hormones, your nervous system, your energy levels, your mood, your metabolism, and even how your body responds to stress. Many symptoms people experience every day, such as bloating, fatigue, anxiety, brain fog, skin problems, and unexplained weight gain, often do not start where they appear. They often start in the gut. In this video, I want to explain why gut health controls more than digestion, what your gut is actually responsible for, and why treating symptoms alone usually doesn't work. This is not about trends, supplements, or extreme diets. This is about understanding how your body truly works. Most people imagine the gut as a simple tube. Food enters, food exits. But medically speaking, the gut is a complex organ system. It contains over 100 trillion microorganisms. Around 70% of your immune system lives there. It has its own nervous system, hormone-producing cells, and a highly intelligent barrier that decides what enters your bloodstream and what stays out. Your gut is not passive. It constantly communicates with the brain. It responds to stress, it adapts to danger, and it always prioritizes survival. This is why gut symptoms often appear during stressful periods, after illness, after antibiotic use, or during hormonal changes. The gut is always listening to your internal environment, and it reacts accordingly. One of the most important connections involving the gut is its relationship with the nervous system. There is a direct communication pathway between the gut and the brain known as the gut-brain axis. This communication goes both ways. The brain influences digestion, and the gut influences how the brain feels. This is why stress can slow digestion, cause bloating, trigger cramps, create urgency, or even shut digestion down completely. But it also works in reverse. Gut inflammation can increase anxiety. Gut imbalance can affect mood. Poor digestion can cause brain fog and fatigue. This is not psychological, it is biological. The gut contains millions of nerve endings. Some doctors even call it the second brain. When the nervous system senses danger, digestion becomes less important. Survival always comes first. Digestion requires safety. It requires calm, proper blood flow, and time. Stress signals the opposite. When your body is under stress, whether emotional, physical, or internal, the nervous system shifts into survival mode. In this state, blood is redirected away from digestion. Gut movement becomes irregular. Acid production becomes unbalanced. The gut barrier can become more permeable. This is why people experience bloating without eating more, reflux without dietary changes, constipation during stressful periods, or diarrhea during anxiety. The problem is often not the food itself. The problem is signal priority. The body is choosing protection over digestion. The gut also plays a central role in immune function. About 70% of your immune system resides in the gut. Your gut constantly decides what is safe, what is dangerous, what should be tolerated, and what should be attacked. When the gut environment is balanced, the immune system remains calm. But when the gut barrier is compromised or the microbiome is disrupted, the immune system becomes reactive. This can lead to food sensitivities, chronic inflammation, autoimmune activation, skin conditions, joint pain, and persistent fatigue. Many people treat immune problems directly without addressing the gut. This is like silencing an alarm without fixing the fire. One of the most frustrating experiences for patients is being told that all their tests are normal, while their symptoms are very real. This happens frequently with gut issues. The reason is that many gut problems are functional rather than structural. The tissue looks normal, but the signaling is off. Digestion is controlled by nerve signals, hormones, movement patterns, and stress responses. Standard tests often miss these regulatory problems. This leads people to believe that nothing is wrong, when in reality, something is wrong, just not at the level of visible damage. This is why symptom-based treatment alone often fails. The gut also plays a major role in metabolism, not just through calorie absorption, but through signaling. It influences blood sugar regulation, insulin sensitivity, fat storage signals, and hunger and satiety hormones. When gut signaling is disrupted, the body becomes metabolically inefficient. This can cause weight gain without overeating, difficulty losing weight, energy crashes, and strong cravings. Many people blame willpower, but this is rarely a willpower issue. It is a communication problem between the gut, the brain, and the metabolic system. Trying to fix metabolism without addressing gut health is extremely difficult. Most people try to fix gut issues with supplements, elimination diets, probiotics, or detoxes. Sometimes these help temporarily, but often symptoms return. That's because the root issue is not being addressed. Gut health is not about forcing the system to behave. It is about restoring safety, rhythm, and regulation. Without that foundation, the gut will continue to react. Healing is not about control, it is about communication. So why does gut health control more than digestion? Because the gut is not separate from the rest of the body. It is deeply integrated with the nervous system, the immune system, hormones, and metabolism. When the gut struggles, the entire system feels it. And when the system feels unsafe, the gut reacts. In future videos, I will explain why symptoms persist, why healing takes time, and how to approach gut health from a medical and realistic perspective. If you want calm, doctor-led explanations without fear-based advice, subscribe to this channel. Gut health is not about doing more. It is about understanding better. Thank you for watching.